Hello everyone. In this video, we'll be discussing about the fundamental starting position of sitting. In last video, we discussed about standing and kneeling. The third position is sitting. So this position is taken in chair or stool. The hips and knees, they are flexed to right angle and the feet, they rest on the floor. And it is the most used position in daily life. Next is a muscle work. So this position does not need much of the work to be done by the legs to hold on to the position, but the flexors of hip, they work to maintain a right angle and it prevents the tendency to slump. Also the muscle work of the rest of the body, it will be same as in standing. So the effects and uses, this is most comfortable of positions and is very stable. The rotation is limited to spine as the pelvis, it bears the weight of the upper body and the pelvis is fixed. And it is suitable for non-weight bearing exercises of the knee and foot, and they can be performed in this position. Also, it is suitable for training correct alignment of upper body in habitual sitting. So these are the derived positions from the sitting position. Long sitting. So the patient sits with legs fully extended and supported for the whole of their length. The trunk and the thighs at the right angle. So effects and uses of this long sitting is it stretches muscles at the back of the thigh. If they are too short and the pelvic tilt is diminished by stretching the above muscles, this causes again a straightening out of the lumbar spine and stretching of the ligaments and muscles at the back. Therefore, it is used in the treatment of lordosis. Also, the abdomen, it becomes compressed so that the pressure there is increased. And as the abdominal muscles already explained, so it must also work to maintain the position. Sometimes respiration is impeded. So therefore, this position, it must be avoided for the patients with lungs or heart complaints. Other right positions from sitting are crook sitting, stride sitting, cross sitting, side sitting, and foot sitting or squatting. So clinical application, we can perform leg extension exercise. This is a simple classic exercise which is mainly used to strengthen the quadriceps muscle. So these muscles, they are surrounding the knee and they provide more stability and support to the knee joint. And also sometimes ankle weights or the resistance band can be added to the exercise. And we can also use it on an exercise ball to make the move more difficult. Then lateral pull downs with the resistance band. So the lateral pull down exercises, they can effectively used for hypertrophy or strength training adaptations. Although pull-ups may induce hypertrophy or strength, they provide additional challenge and adaptation in kinetic chain functionality. Next position or next fundamental starting position is lying. Lying is the most easiest of the fundamental positions, most stable due to lower placement of center of gravity and broader base. The muscle work in lying is minimal, not much movement occurs in this position, and it is taken on a soft mattress as it gives way to the contours of the body. But it can also be taken on the plinth or a hard surface, and the head, it can roll to either sides. So muscles, mainly the head rotators, they work reciprocally to stabilize the position. Extensors of hip and flexors of lumbar spine, they can work to hollow the back. Then the medial rotators of hip, they can keep legs in neutral position. So effects and uses, the spine is relieved of the weight of the upper body, which is suitable for many exercises. Also, the static posture training can be carried out as alignment of the body is same as in the standard. And it is also used in the treatment of spinal deformities. Sometimes lying is unsuitable for patients with respiratory or heart conditions because there is increased pressure of abdominal viscera And elderly, they sometimes have a problem because there will be hindrance to return of the blood from the heart. So various derived positions of lying are prone lying, half lying, crook lying, and side lying. So prone lying, the anterior portion of whole of the body is turned towards the couch or floor, and this position is inconvenient for maintaining for a longer period. And all the body parts, they are relaxed. Head is also get relaxed, and if it turned and kept apart. So this position is very much difficult for the respiratory distress and elderly patients. Crook lying. So modifications are made in the lower limb in the supine lying position, and the hip knees, they are flexed, and the feet, they are kept forward. So mainly this position is used in exercise therapy for abdominal muscle strengthening. Pelvic bridging exercises can be performed in this position. The clinical application could be that in hamstring stretch can be done while lying on the back. And most of the patients with low back pain or leg pain, they sometimes benefit with the hamstring stretching exercises. And these are, this position is least stressful for hamstring stretching. The last fundamental starting position is hanging. So the body is suspended by grasping onto something with fingers and palm, forearm being pronated, arms are straight and shoulder width apart. The head is held high, scapulae, they are drawn down and together. The trunk and legs, they hang straight with heels together and ankles plantar flexed. So the uses, it is suitable for the athletic person with high muscle strength, and it produces a passive stretching of the spine, its ligaments, especially in the lower part, and therefore sometimes it is used in treating the spinal curvatures. It raises the ribs by stretching the shoulder muscles, and therefore sometimes used in the treatment of flat chest. Muscle work. So flexors of finger is used because they are grasping. Wrist, it reduces the strain on the joints and synergists to finger flexors. Flexors of elbow, they are also acting to reduce the strain on the joints. Adductors of shoulder, they lift the body on arm. Depressors, retractors, and medial rotators, they fix the scapulae and brace the upper back. And the prevertebral post neck, posterior neck muscles, they maintain the position of head and neck. The flexors of lumbar spine, they correct the tendency to arch the back. The adductors of hips, they keep the legs together. Extensors of knee, they maintain the full extension at the knee joint. And plantar flexors, they help to point toes to the floor. So effects and uses, the hanging, it requires extensive work of upper back and arms. So people with strong muscles, they maintain the body weight, they can use this position. The children, they enjoy this position in play, but it is not suitable for weak individuals. So various derived positions from hanging. First one is a half hanging. So this position, it requires very strong muscle work for the back muscle, especially the scapular retractors, which work against gravity and the weight of the body. And normally it is used in the gymnastic activities. The exercises that can be performed, hanging knee exercises, and mostly the strengthening of abdominal muscles. A person can go for hanging knee raise exercise. Mainly the lower abdominal muscles are strengthened. Then flexed arm hanging. So this is an exercise that tests the strength and endurance of the muscle in the upper body. The main muscles used for the flexed arm hang are the biceps, forearm, and finger flexors, and several back muscles. The flexed arm they hang is used by the bodybuilders or sometimes in the military training. Thank you. So this finishes our this finishes our fundamental starting positions.